Okay, everyone, I think we're ready to roll. Welcome to Better Health's coverage of HIMSS. This is our very first interview on the first day, and we have a brave man here who is willing to try out this technology with Ustream, and we are excited that we have a whole group of Twitter followers from around the globe who are watching this Ustream video, and so I thought we would get started with some questions. Here we have Jeff Forbes, who is the VP of Healthcare Solutions at Siemens, and we're going to talk a little bit about saving money in healthcare and also about what Siemens is doing in the social media space. It's pretty exciting. So Jeff, thanks so much for coming in, and I wanted to ask you to begin if you could tell us just a little bit about the ways that Siemens is looking at saving money in healthcare.
Okay, great. Well, thank you. I'm glad to be here. Just quick clarification for everybody out there. I'm with Siemens Enterprise Networks, which is the communications arm of Siemens, but I'm specifically focused on healthcare practice. We're here at HIMSS showing basically 5 sort of major ways that we can attack the cost of healthcare. I would put maybe 3 ways in sort of your traditional IT sort of savings, which really kind of go around the infrastructure costs, how to take that cost out, leveraging open standards to be able to provide customers more of an opportunity to embrace different technologies in a seamless way, to take advantage of SIP trunking, internet type of trunking, so that on a lower cost basis. And also some of our mobility applications, being able to leverage, your PDA, your wireless to facilitate communications, have that device be your primary device as opposed to having to have a dedicated landline. Now you can leverage mobile technologies. Then there's sort of 2 other ways we really believe that are very, very powerful ways to save money in healthcare. One is around the contact center, really the front door of healthcare institutions in terms of how do you leverage the access and the intake to the system. And we've got some exciting solutions around that. And the other is around the bedside, a bedside communications device and solution that's very, very powerful. And both of those 2 technologies touch multiple stakeholders. So there's multiple sort of cost out value with those 2 technologies. So that's what we're showing.
Well, terrific. So the average physician then, how would they interact and engage with your solutions?
Well, if you're looking, let's say, at the contact center, think about scheduling. I mean, obviously a physician's time is precious. They want to maximize their time. An investment in these types of solutions, and there's multiple components, that's why I say solutions, would assist the physician in making sure that their schedule is optimized. If let's say they had a website or something like that and they wanted to allow online scheduling, our devices and technologies would facilitate that. An individual could come on the website, could be looking at maybe a schedule for whatever the procedure is. If they're having trouble, they could click on an icon, and if it's set up appropriately, connect with a live agent to be able to then facilitate that patient with the call. It could be appointment reminders to make sure that in a proactive way the patient is contacted in advance to remind them that they have an appointment so that they don't have unrealized revenue streams by people not showing up. Those are 2 ways a physician might experience the benefits of the contact center solutions.
And then for me to use it, I would need to be at a hospital that has your solution. Is that right?
Well, most of these are really, hospitals have more progressive sort of contact centers, but a large physician's practice also could leverage this. There are different gradients or sort of levels of sophistication for these. Most of them are enterprise-wide. In other words, they can go from small to large. But it would not be a sort of a sole proprietor that would leverage this. I mean, that would probably could be done by an individual who's answering the phone. But yeah, and actually this technology is becoming way more widely deployed now with the pressures that are obviously in healthcare. Do more with less, but do it better, smarter.
Tell me a little bit more about the mobile aspect of your strategy. Clearly, I mean, we've been hearing a lot about how mobile is the future and, because everyone has a cell phone. Mm-hmm. So what sort of things are you developing in the mobile space?
Well, I mean, we're trying to leverage technologies that people have today. I mean, obviously, there's a big debate that's raged about what's the right device, for a doctor or clinician in a hospital. There was the BlackBerry platform, there was the Microsoft CEs, and then obviously the iPhone. Nobody can ignore the iPhone or the iPad now. So it's how do you leverage those technologies? So what we've developed is really an architecture around leveraging mobility. And we have a solution called OpenScape, which has a client that can reside on the mobile device that allows us to sort of unify communications. You can see presence, you can collaborate, one number, anytime, anywhere. and you can understand where people's presence are. You can IM, and you can do all those things. And it actually is the same form factor that if it was on a laptop or a client on your desk in the office, will be the same sort of interface you would have on your wireless. So case in point, a doctor's doing rounds or something like that. He needs to collaborate with another doctor. He can immediately go to his buddy list that might be on his cell phone, tap, connect, conference, and bam, you could be in a conference. I mean, the system then takes over. It's really to demystify all those keystrokes, sequences, and having to remember numbers or call somebody. I mean, there's a tremendous amount of, I mean, in sort of the older way of doing it was I'll call somebody at the desk to set up that conference call or to find somebody. So it facilitates communication, takes steps out, makes it easy.
That sounds really nice. Does it also facilitate communication directly with patients?
It could. I mean, if the patient had a one of those device, but it's really I think it's more for the care teams inside the hospital consultation. We are looking at how to leverage sort of the consumer interface, and there are applications we're toying around. But predominantly, what we're showing right now is sort of doctor to nurse, administrator inside the basic support teams that support hospital delivery, whether it's patient transport, or it could be lab to somewhere else.
That's great. What's your favorite solution that you're working on right now?
I mean, I think really one of the most exciting things we're working on right now is this sort of bedside communication solution, which is a bedside terminal coupled with some very, very powerful software that resides on that terminal, coupled with the unified communications. And really what that does is to bring together a lot of power by the bedside. So there's multiple stakeholders that would benefit from that technology. One is, if you look at the clinicians, they could get into electronic medical records. It could be a secure access with a security platform that sort of protects it. Proximity card, they tap the monitor by the bed. It launches a session of the EMR. Maybe they're going to need to input something, or they're going to bring some records up to share with the patient. Another level of authentication to protect for privacy and authentication. So they're in there. They then can review that with a patient, or if they need to collaborate with something, they can leverage the unified communication technologies I talked about. From the nurse capability, I mean, they can administer meds there. It's got barcode reading capabilities from that terminal. And from the patient, it brings them sort of what we'll call as infotainment. It brings them TV, internet. It can bring them games. It can bring them access to information that they may need. It also can deliver patient education. There's a number of modules that can be delivered to that by the bedside. So there's a lot of savings that could come out through the convergence of those technologies by the bedside. We think it's a more costly way to look at this. If you think about all the things that are in a room, and all the stakeholders that sort of own or are responsible at, and all the ancillary costs that make up to administer and support and invest in that technology, we think it's a very, very powerful savings tool, yet delivers great patient satisfaction, educates the patient, reduces the risk, meets compliance regulations, and can help with, let's say, we think meaningful use types of activities to ensure that the EMR adoption is going very aggressively.